Hey, it's Dr. Hannah with this week's Hot Topic. Today I want to talk to you about reasons why you shouldn't wear your belt so tight. Now, not other than the fact that it just might look weird and just silly if you have your belt too tight because skin is in places that it really shouldn't be, but it's also really bad for your health. So if you have some of these symptoms that I'm going to talk to you about, a simple answer could be just loosen up your belt a little bit. If that's not the case, then obviously you want to come get it checked out. First thing you could notice if your belt is too tight is you might have heartburn. Reasons why is if you have your belt that's so tight, the food that you've just swallowed has nowhere to go because there's like this stoppage point that's kind of right at your stomach. So it just has to go up a little bit. So that could be a reason why you have heartburn or that acid reflux, because the food just is trapped and it doesn't have anywhere to go. With that same thing, you could also have stomach pain with that. If the food is trapped, it's going to form this little blockage. So you could be bloated, you could have a lot of stomach pain, a lot of gas, and you could also be really constipated because, again, there's no room and no area for this food to go that you've just ingested. Other thing for a tight belt, and this one's probably the most common one, is lower back pain or some hip and pelvic issues. If the belt is too tight, you have those joints in there that they can't really move, and that causes some pain if you don't have that full flexibility range of motion in there. Alternatively to that, you could also have some numbness and tingling that goes along with that. You have these big nerves that come out right about your low back and your hip, and if that belt is pulled too tight, it's going to compress those nerves, and then you're going to get numbness and tingling down your leg. Just like if you kind of lean on your elbow and you're cutting off that nerve supply, it's the same kind of thing, except you just have a tourniquet basically around your waist, and that's why you're having that numbness and tingling. And if it's so bad, you can actually lose some function, some mobility, and things like that. So you want to loosen up that belt a little bit if you can, if it becomes a little uncomfortable, or if you feel like your pants are just falling down, you should probably just go shopping and buy some new pants. The last thing, the reason why you don't want to put on your belt so tight is because it can affect your immune system. Now, we have a lot of our most vital organs are kind of in that stomach area, so your intestines, your stomach, your liver, gallbladder, you kind of get the idea. But if that's super tight, you can actually cut off the blood supply to some of those organs. If you cut off the blood supply, it's gonna die. Now, that is like a super extreme reason why you shouldn't do your belt, but if you do tighten your belt really, really tight, that's a potential thing that you could have if you do this every single day because it's on that single notch that you've been doing for years. This is just a thing that's going to be repetitive, and it can be really bad for your health. So think of those things the next time you put on your pants, and if you have to, right after you eat, just loosen your pants up or wear fat pants. I mean, it's funny how most of us are like, oh, I just got to put on my fat pants after I eat, but that also is another reason why you don't want to have your belt super tight, especially after you eat. So hopefully you found this pretty interesting and entertaining, and that's all I have for you guys this week. We'll see you next time.